Number one thing is helping people.
We are very compassionate. We put our patients' needs first.
A welcoming, loving environment. That's, I think, the number one thing I could say about Fredericksburg Orthopaedic Associates.
In this region, we're one of the leaders as far as orthopedic physical therapy goes. We have 3 facilities throughout Fredericksburg, in Massaponax, Fredericksburg, and in Stafford, so we have good connection throughout the whole area.
We do a lot of post-operative care, getting people back, getting full motion and strength back into the system that was worked on, getting back to a functional lifestyle.
They come to us in a very, very bad time in their life. They've had injuries, they've had surgeries, they're very apprehensive, they're very nervous. So part of our job is to educate the patients, reassure them that we are going to help them through this difficult time. We have a variety of treatment techniques. We use ultrasound, which is our deepest penetrating heat. We do the fluidotherapy, where people can have heat, massage, and do their range of motion exercises in the heat. We do strengthening exercises, including the dumbbell weights. We'll do a variety of hand functional activities, including using clothespins and pegs to get the dexterity back and get the grip and the pinch back to the hand.
I see hope now. I had a broken wrist, a very bad broken wrist. I could only move my fingers this much, that's it. Now I can do this. And getting my grip back and my movement back, and they have just been amazing. I've made such great strides with working with Grace and her team.
It's on me to make sure right off the bat from that first visit that I'm building a connection with that patient and make sure that they can see that I'm on their side. They can expect the highest quality knowledge and skills when they're receiving the therapy here.
Continuum care is very important. We work closely with the physicians with it. We have great treatment plans with it. We have great support staff here, and we work with the patients to determine their individual goals and what they want to achieve with therapy. Maybe it's an elderly person, they're having trouble getting in and out of that car or walking around their house. So working with them, you gradually restore that function with it. So it's great, especially when you see the look in their eyes when they're doing things that they haven't done and they're not hurting. And that's a great reward.
I care a great deal about the people that come in. That's why I got into this field. If you're coming to see me to get better, you're trusting me with your care. If the patient knows that you know what you're doing, and you can explain all the mechanics of why it hurts and what each phase of the rehab process encompasses, then it's easy for them to tolerate the pain or the repetitive exercises in order to achieve that benefit.
The majority of time you see great strides and achievements over the course of therapy, and it's very rewarding when your patients are done saying, you know, this is the best I've felt in months or years, and we got me back to work or the sport that I'm going to.
This is what drives me in my work, is to help people get better faster. And when I see results and the patient sees results, we know we're on the right track.
I had a woman tell me that she hasn't been able to tie her shoes in 5 years. She said, "Yeah, I can tie my shoes again." That's rewarding to me, to see people get their life back.